Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for herpes. What is herpes? Owing to infection by herpes simplex virus, ulcer or blister-like wounds may appear on genitalia or mouth. These are called herpes. What are the types of herpes? HSV means actually herpes simplex virus. Number 1, HSV1. It forms blister around mouth, oral herpes. It remains 2 to 3 weeks. HSV2, responsible for herpes about genitalia, a type of sexually transmitted disease. This is called genital herpes. It remains to 2 to 6 weeks. Now, a few pictures has been, relevant picture has been demonstrated. Please check this so that you can identify when you get a patient. What does WHO say about herpes? World Health Organization says about herpes that about 67% and 11% persons in the world get infected with HSV1 or HSV2 respectively in their lives. Mind this thing, the HSV1 infection by HSV1 about 67% of the total population of world. HSV2 11% of the total population of the world are infected in their lives. According to modern medicine, once a person gets infected with this virus, its reinfection can be moderated, but the same can never be cured. Mind this, once HSV infection has entered in the system, it will remain there till death. It can never be cured, but it can be managed. What are the other signs and symptoms of herpes? Number 1, before appearance of wounds, burning in the skin, mild body pain, headache, uneasiness, itching may be seen. Number 2, cutting, stabbing, electric shock-like pain in wounds, itching, liquid exudations, fever, swollen limb glands. Again, various types of herpes picture has been shown in the DR. Please note it so that during practice, when patient comes with eruption, you can identify that it is herpes. How does herpes spread? Number 1, HSV2 spreads from anal or genital or other sexual intercourse, kisses, sex toys. These are pictures of sex toys. Number 2, HSV1 infection spreads from contact of virus from sore, saliva, scald, ulcers, skin to skin it's called. Please note that from any article like towels, napkins, clothing, utensils, etc., herpes never spread. How to prevent herpes? Number 1, having herpes zoster vaccine minimizes chance of infection by 50%. Using condom, avoiding touch with herpes ulcer, wounds, etc. Now, what are complications of herpes? Pneumonia, encephalitis, hepatitis, post-herpetic neuralgia, etc. may occur from herpes. Who are predisposed to herpes? Persons with weak immune system are predisposed to herpes. Silicea for herpes. Actually, remedies are starting now. Eruptions tend to ulcerate easily. Herpes in chin, nape of the neck. When this term, nape of the neck, is a particular area of the neck. This area is called nape of the neck. This area, just below the hairline in the neck. And mons pubis, warts on arms and hands, skin very sensitive, slight wound, ulcerate, get palsy. Patients very chilly, hug fire, want plenty of warm clothing even in summer, suffer from want of greed, physically, mentally, fidgety, starts from little noise, sensitive to cold pain. These last 3 lines relates to the generalities of the patient. This individualizes the patient. These are not characteristics, these are generalities, and these are most important. If this symptom corroborate, then the medicine will act certainly. Mind it, every medicine has got, especially, actually there are 4 or 5 types of symptoms, especially 2 types. Like one is characteristic symptoms of the disease itself, and another are the generalities of the patient. The generalities of the patient are most important because that individualize a case. In this video, I have always tried to underline the generalities of the particular medicine. Thuja for herpes, herpes zoster, all over the body. Zoster actually, herpes zoster actually that particular herpes which comes from the virus of chicken pox. All over the body from suppression of gonorrhea. They each burn violently. White mealy scaly herpes. This is the type of white mealy scaly herpes. Eruption only from covered parts, burning fiercely when scratched. Worse from cold water, heat of bed at night. Better feeling from gentle rubbing. Patients hurry in everything, ill humorous, overexcited, angry, weep. Hearing music, averse to life and sad. Last symptom, last 2 lines, general symptoms. Netramure for herpes, herpes labialis during fever, herpes on bends of elbow, knees, herpes succinatus, humid herpes on scrotum, thighs, large red blotches to itch violently. Worse from heat, better in open air, lying down on perspiring. Tongue mapped. Mapped tongue is the netramure guiding symptoms. This is mapped tongue. Mapped tongue, they are sad. That means the netramure patient, generally is coming. They are sad, cannot tolerate fast persons who offend them. Awkward, drops things often. Absent-minded, weeps easily. Natic acid for herpes. Herpes of whiskers, between fingers of Allen acid. Herpes on outer side of thigh, in bends of extremities. Worse in open air. Change weather, contact. Better cold air. Lying down, riding carriage. Tongue dry, fissured. Note the tongue, dry, fissured. Patients irritable, hateful, vindictive, tremble in anger, fear of disease, of death, and hopelessness. We truly, for herpes. Herpes in the nape of neck. I have already explained nape of neck. Chest, scrotum, perineum, knees, ankles. Scabby, dry herpes on face. Itching herpes followed by ulcers. Deep cracks. Worse in open air when perspiring. Better from warm air and warmth. Meserium for herpes. Herpes zoster following course of intercostal or supraorbital nerve with sharp stitching, boring, lightning-like pains which leave the parts numb, worse in bed from touch. Vesicles form a brownish scab. Neuralgic pain continues for some time after disappearance of herpes. This type of herpes is called intercostal nerve due to affection of intercostal nerve. Sepia for herpes, eruption about elbow knee joints, scaly herpes on hands, on necks and behind ears, glandular swellings, itching, changes to burning after scratching, worse during menses, pregnancy and lactation period. Troubles reappear every spring. This is a very important symptom. Troubles reappear every spring. Suriname for herpes, moist herpes on suppressed itch. Itching intolerable when getting warm, worse before midnight and in open air. Skin looks dirty, dingy, as if never been washed. Offensive odor from body despite careful washing. This is peculiar symptoms of Suriname. Herpetic eruption mostly in the bends of joints. Rastox for herpes. Right-sided herpes zoster with incessant itching, burning, tingling, alternating pain in chest and dysenteric stool. Mind is how the herpes is associated with other type of disease. Dysentery, pain in chest. Of course, pain in chest may be there from nerve affection. Herpes on hairy parts, more uneasiness from after perspiration. Worse in winter, hardly any eruption in hot weather. Sulfur by herpes, greenish yellow herpes, reappearance of repelled herpes, burning and after scratching, which gives temporary relief. Worse from washing or on getting warm in bed. Adapted to herpes miliaris, herpes succinatus, squamous. This miliaris, succinatus, these are old variety of herpes according to old concept. Now this concept are not being used. Patient put their feet out of wrapper to keep them cool. Sulfur journalists tend to keep bare-bodied unmasked. Likes sweet, symptoms tend to relapse. With this, the video ends. Thanks for listening and viewing. If you feel any difficulty, please write out in the comment section. I will certainly respond.